Good afternoon, everyone, and you are very welcome to this lunchtime episode of QPS TalkTime. And I hope the sun is shining wherever you are. We have a great session for you today, and I will introduce our speaker in a few moments. And today we're going to focus on how to design a survey for QPS Work. So we know this is something very important to lots of our audience, and we'll get into that session very quickly. Follow us on social media. Again, you can watch back previous episodes of QPS TalkTime, and we have a large bank now of videos with many great speakers, and you can watch that on our YouTube channel at National QPS, or you can follow us on LinkedIn at HSE National QPS. Just a plug for our Walk and Talk Improvement podcast series. We really have some fantastic podcasts up there now. And the QR code there will take you to where you can download or listen to the podcast, and you can get the podcast on all your usual podcast apps. And we really would encourage you to listen, and please to share those podcasts with your friends. Special one that we really enjoyed, myself and Anita had the pleasure of having a conversation with John Berwick, founder of IHI and one of the great influencers in quality improvement over the last 30, 40 years, and really enjoyable conversation, and I think lots and lots of wisdom from John Berwick to be listened to there. So if you're going for a walk in the nice sunny weather now, get your headphones out and listen to the conversation we had with John. Again, just making people aware of some great resources that are out there. Quality and Patient Safety Competency Navigator, and the QR code there will take you to that. And that's really for teams to help them identify what they have, what they need, and how they can improve the things that they need to improve quality of care where they work. So please do check that out. And again, that's only part of the whole prospectus of quality and patient safety education materials and resources that are available. And again, the QR code will take you to the prospectus, including our own program run in partnership with the Royal College of Physicians, the postgraduate certificate in quality improvement and leadership, and that is open now. So plug there for anybody who's interested in that. Please check that out and get your applications in. Today, you're going to learn about how to use and create surveys effectively for quality improvement, hear about the common mistakes in survey design and how to avoid them, find out what factors to consider when writing survey questions, and then we're going to explore some resources as to make you a better user of surveys. So it's a real pleasure to welcome to QPS TalkTime today Dr. Anita Rowe. Welcome, Anita. And Anita is a Senior Improvement Advisor with the Health and Social Care Quality Improvement, HSCQI in Northern Ireland. And it's a real pleasure to welcome you. And you're going to talk to us about how we can get more from our surveys in our quality improvement work. Anita.
Good afternoon, John, and everybody on the call. It's great to be with you this afternoon from a sunny Belfast. And I am delighted to share with you a little bit of the knowledge, I suppose, that I have acquired along the way in terms of survey design. So just a little bit about my background. I'm a speech and language therapist by background. And following completion of my PhD in 2020, I worked in the Belfast Trust for 2 years as the Quality Improvement Lead for Allied Health Professionals. And I suppose it was really through that work that I got very interested in survey design, because a lot of the teams I was working with were using surveys in their quality improvement work, but they were really finding it challenging to actually create a very effective survey. And so, having covered a little bit of that during my PhD, I sought to address that by putting a session together. And I've been amazed by how many people are actually interested in survey design as a methodology. So John's already been through the objectives for today, but just I suppose to say that if we did have a lot of time today, I would love to workshop how we could actually create an effective survey, and we could really delve into that in more detail. Time obviously doesn't permit that. I'm aware most people are on their lunch break, and we're going to just go through a bit of a whistle-stop tour to address these objectives around what are the common mistakes and how can we avoid those. And what we're going to do to address that is I've created a very brief, fictional, non-healthcare example to try to demonstrate how I would actually get started with designing a survey. So I'm really passionate about improvement in health and social care, but I'm also a lover of food and good coffee. So every now and again, I have a bit of a dream around what would it be like if I gave up the health and social care space and started to open my own coffee shop / deli. So let's imagine that I've actually taken that plunge and I am running my own business. And initially things go really well, but I start to notice some decrease in customer numbers. The footfall isn't what it would be. And obviously I want to do something to increase my customer base and to increase that loyalty of customers to be returning to my establishment. So I've decided that I'm going to use a QI approach to this, because that way I think I'll be able to test change ideas and really understand what matters to my customers and therefore make a difference on my outcome measure, which would be my customer numbers. So I think a survey is a great idea, and I've loads of ideas in my mind. I have lots of questions that I'm very keen to ask my customers. But what I'm going to need to do is actually resist the temptation to start writing survey questions. And I suppose this is my spoiler. If you hear nothing else today, this is my big piece of advice about surveys. Most people tend to want to jump in by writing survey questions, and often that's like taking one step forward and then two back. And this session today is really all about asking the right questions. So somebody said, and I don't actually know who it was, said knowledge is having the right answers, wisdom is asking the right questions. And I might be taking that quote a little bit out of context, but it resonates with my thoughts around survey design. We need to ask the right questions in a survey, of course, but we also, as we develop a survey, need to pause and ask ourselves the right questions about the methodology. And again, we referenced Don Berwick earlier on, a forefather and great proponent of quality improvement. One of the forefathers of quality improvement, Edward Deming, said, if you do not know how to ask the right question, you discover nothing. And I really think that is true when it comes to quality improvement. You will only get out of a survey the data that you need for quality improvement or patient safety work if you actually ask the right questions. And the first one is the survey actually the right method for my QI project? So I suppose it's worth remembering the aim of what you're doing with the survey is not to create a survey. The aim is about what it is you actually want to achieve from that survey. The survey is just a method. And what was drilled into me when I was doing my doctorate was your aim dictates the method. That's true in quality improvement work. It's true in research. So we really need to think about, well, is a survey actually going to give me the data that I want? And that really comes down to, well, what is a survey in the first place? And I suppose that seems like a really straightforward question, but it's worth just looking at a definition of surveys. It is, of course, a tool to give us both quantitative numerical data and qualitative or descriptive data. And I like this definition. It's very old, 1971, but Franklin and Osborne said, a survey is an instrument consisting of a series of questions designed to elicit responses which can be converted into measures of the variables under investigation. And there's just a couple of points that I want to pull out of that definition. And the first one is surveys are designed. They're not just a list of random questions, and that's why I would say don't start with just writing questions. They're questions that are put together in a very logical, very consistent, considered way. And to me, surveys have an architecture. They flow in a way that encourages the respondents to give accurate and reliable responses. That is what you're looking for. And secondly, surveys have questions that are focused, they're specific, and they're relevant to your project aim. They must measure the particular constructs that you need to know about that are of interest to you. And a good survey will do that. A good survey will be valid, as in it will actually measure the concept that you intend it to. It will be reliable. That means that two different people should fill it in the same way, or if the same person filled it in on 2 days, they would respond in the same way to your questions. And it should also be sensitive, so it should help you to detect the difference between people or the difference between variables. It should be free from bias. It should be easy for you to administer, to analyse and to report on, and that's a key consideration that I would say think about at the very beginning. One of your first questions as well should be, how am I going to actually do this? How am I going to analyse this data? How am I going to report on it? And ideally, it should actually be quite enjoyable for people to fill in. So a well-designed survey tool can be extremely useful in quality improvement projects, and it can be used at any stage in a project. Now, depending on what your quality improvement journey looks like, which you'll see on the next slide, You can use a survey at any point. You can use it to identify your quality or safety issue. You can use it to understand the problem, to develop your change ideas, to test those ideas and know which one makes a difference. And that's something we might come back to later in terms of how we design the survey. And it also can be useful in terms of understanding whether your improvements have been sustained and implemented effectively over time. But of course, as a method, it has inherent advantages and disadvantages, and we'll see those on the next slide. So I'm not going to go through these in detail because they're very self-explanatory. But the key point really is, I think one of the reasons people often jump to doing a survey is because they're so easy and quick to actually do. They're often our go-to method, aren't they, in improvement work? But we do have to weigh that against the fact that they are often very poorly responded to. Response rates tend to be very low. And also you are very reliant on how your respondees will interpret the questions that you ask. Because of the nature of a survey, you can't probe for further detail and you can't ask why somebody has responded in a particular way. So what you're going to use that data for can be limited at times. And that's why I would always add a note of caution to just not jumping to doing a survey. So we do need to be mindful that if you want some really rich data about people's thoughts and opinions about something, perhaps a focus group is a more effective way of doing that. So it's always about thinking, is this actually the right method? And of course, the big barrier to surveys at the moment is that survey fatigue is a very, very real issue. And one of the reasons why we're getting such low response rates at times to surveys. So I'm sure we've all felt really frustrated at times about being asked for feedback on everything we do, be it a trip to Marks and Spencer's, setting up your car insurance. We seem to be asked questions on all of these daily life events. And so surveys seem to be everywhere and we can all get very tired by doing them. So thinking back to my coffee shop example, is a survey actually the tool for me? Well, yes, I think it is. For a few key reasons on the slide there. I could build in measures quite easily that I could track my data over time. It would be quick and easy for me to do. My customers probably won't mind filling in a couple of short questions and it can be quite freely available to me. So I'm thinking that yes, it is something I want to do, but what do I need to do before I even think about writing the questions in it? And on the next slide, we should have a few questions and early considerations that we need to think about as we prepare for putting a survey together. So first of all, a really good question to ask you, well, is there one already out there that you could use? Is there a validated or a non-validated tool that is already in existence? Don't reinvent the wheel. And again, I'm not going to talk through all of these factors in detail, but just to say there are three really important practical considerations that I would encourage you to think about at an early stage. So those are around the ethics, the information governance and data protection approvals that you might need, and then the administration details. How are you actually going to do it? Who's going to hold the data? Where's it going to go to? And being sure that you have all of the approvals in place before you even start designing it, because you could end up finding out that there are certain barriers there that you need to address before you even design your survey. But once you have addressed those issues, how are you going to actually start? And I think a useful consideration here, just to get us thinking, I am sure everybody has filled in a survey that they have found very, very difficult to fill in. So what would it be like if we designed the worst survey possible? What would it look like? A really difficult survey to fill in. The next slide should have a little idea on it there, and hopefully a cartoon that people can resonate with. Somebody says, I'm starting to regret buying whatever it was I apparently bought. So what is it about a survey that makes it really challenging to complete? And you might want to just put in a few ideas into the chat function around what a really terrible survey would look like. Usually, in a nutshell, they're too long, there's irrelevant questions, and the wording of them is unclear. You don't really understand exactly what it is you are being asked. I see some comments coming in here about complicated questions, long questions, ambiguity, absolutely. So these are the issues that we really want to try and avoid. So again, my biggest piece of advice, resist the temptation to just start writing down questions. What we actually really need to think about is, because we want to avoid irrelevant questions, we want to make sure we get good data quality. What we want to think about first is, what are the constructs I actually want to measure? Those will help me to form my questions. So I always encourage teams to be as specific as possible in thinking about this before they write their questions. And when we think about patient experience, what exactly is it about the patient's experience that we want to measure? What is it we want to know about? And you can see some examples on the next slide of the kind of common constructs that come in to surveys. I've seen these ones in multiple surveys carried out by teams that I've worked with. And we do need to be really clear about what we mean by those constructs. Operational definitions of the constructs you want to measure are essential when you're carrying out a survey. So you really want to think those through in as much detail as you can, and I'll come back to that in the example about our coffee shop. Then you want to think about, well, what factors might influence my respondents' answers to those questions and to those constructs? And do I actually need to measure those as well? Am I going to want to tell the difference between certain groups? Am I going to have to ask about those individuals and who they are? So you might want to think about their attributes, their demographics, things that they've experienced in the past. You can see some examples of these on the next slide. You might want to know their knowledge of something. You might want to understand their beliefs a little bit. So do certain groups feel differently about what it is you're asking them than others? And you might want to delve into what their reasons are for believing things. So it's important to think about not only the constructs that you want to measure, but are there any variables that are going to impact on people's responses that you also need to capture? But what I would add again is some caution here. Sometimes surveys ask those kind of questions about you as a respondent, and you're thinking, but why do they need to know that? And I think patients can often feel like that. Why are they asking me these questions? And sometimes if you're not going to do anything with that information, then I would just say, don't ask the question. I have worked with some teams where they've asked questions about people's age, and I'm saying, so what are you going to do with that data? Are you going to respond differently to an older population in your caseload compared to a younger population? Is that going to make a difference? And I guess a rule of thumb really is if you're not going to use that data in the future, then I wouldn't build it into a survey. Because again, it adds length to the survey and can put people off responding. So back to our coffee shop example, I'm just going to think through, well, what do I want to know about my customers' views of my coffee shop? And I think I want to really understand what they think about the service that they're receiving, the food and the environment. Those are the three key constructs. But I want to be really specific, because if I just ask what they think about the service, I don't know what it is that I can improve. Whereas if I ask about the speed and the friendliness of the service, then I have an opportunity to put in place some change ideas to improve those aspects of what I'm delivering. Again, for food, be as specific as possible. If I just say, what do you think of the food? I could get any answer back here at all. But what I'm wondering is, do people think the range of choices of food available is a good range? And what do they think of the quality? And I might also want to ask something about, for example, value for money. They might think the food quality is great, but if it's too expensive, they're not going to come back to my coffee shop. Might want to ask something about the environment. There's lots of constructs you could ask, but it's really focusing on what is the aim of the work I'm doing, and therefore what constructs do I want to measure. And I might want to ask a little bit about, did they come in for coffee, lunch, brunch, whatever? That might help me to gauge whether people coming in for different reasons are happier or less happy with the service that they're receiving. So I don't want to add a whole list of variables. It's not going to matter to me in this particular instance how old my customers are or where they live, anything like that. I just want to have an idea of what they think about the quality of what they're receiving. So I now know my constructs, but how am I actually going to write my survey questions? Where do I start with that? And I guess the key here is it's not quite as easy as it seems. So answering survey questions actually is very demanding of our cognitive processes. There's a number of processes that are involved in answering questions, and as a speech and language therapist, I really resonate with this. So the next slide should show some of the cognitive processes that are actually involved when we answer questions. And the first one is comprehension. So our respondents must understand the individual words in the sentence, in the question, and the grammar within the question as well as any instructions that they're also given about how to answer the question. So there's a lot for people to comprehend, and the meaning of what you're asking them could also go beyond the literal words that you use. After comprehension, the next step is retrieval, and respondents must generate a cue and then search their memory to retrieve the relevant, very specific information needed to answer your question. And then it comes to judgment. They have to assess the completeness of the information that they're going to give, and judge whether it is relevant to the concepts in the question. So there's a lot cognitively happening, and that all happens before they respond. And what the research tells us is that after people have gone through all of these processes, they are said to optimize their response. But the research tells us that, not surprisingly, people take cognitive shortcuts, and so they don't often give that optimal response. Sometimes they don't search their memory fully, or they don't fully integrate the information in the question with what they already know or have experienced. And they simply use the most basic cues in the question. So understanding all of this really gives us some insights into how we word questions. We want to be as clear and specific as possible. We want to give people cues to jog their memory, and we really want to encourage them not to just give the first answer off the top of their head. So often I like to use little cues at the beginning of a question, like thinking about the day you left hospital, not just what was it like when you left hospital. So really trying to just help people get into the space where they can go through these processes effectively. And then, of course, there's a number of factors that influence this. So these are going to come up in arrows on the slide. We've got task difficulty, we've got the person's ability level. We obviously have to think about people's literacy levels, their health literacy as well. We have to think about their motivation. How motivated are people to answer your questions, or do they have another agenda on their mind that is going to make them answer in a particular way? And I think it's really important as well to think about acquiescence. Respondents can have a tendency to agree with what you have said. And often, particularly if you're surveying staff, getting truthful responses can be challenging. If staff feel that they are going to say something that is either socially or professionally unacceptable in an answer, they might not give a very truthful response. If they think there's a more desirable one that you're looking for, it's going to affect how they answer. So we also need to think about that. And then just in terms of how we lay out a survey, we need to think about straight lining. And this is when people will just start to answer the same, it's something like agree, and every question they just put agree. And I fully accept that I've been guilty of that sometimes on those quick survey sheets at the end of a course, and you put agree for the first one, and then you think, oh yes, all of those are agree. And you don't stop to think about, well, do I strongly agree to that one, or do I just agree? So straight lining is something we need to think about. And what happens in the worst case scenario with that is people don't even read each comment that you're asking. They just tick the boxes. And primacy is the last factor there, which means that people don't read the full question. They just respond to the first bit of it. So being very careful about the thing that you want to ask people, do you need to put that at the very start of the question? And so we really need to remember that the quality of our questions will absolutely affect the quality of the data that we get from our survey. And the challenge for us using surveys is we can be completely unaware that this has happened. We don't know that people have interpreted our questions the wrong way. And that's why I was suggesting earlier that sometimes a focus group can help, because when somebody's talking to you in a focus group or a semi-structured interview setting, you can say, oh no, that's not what I meant. I want you to think about whatever. And so you have a chance to control that. Whereas when people complete a survey online or in a hard copy for you, you don't know how they have interpreted your question. So this means that to counteract some of these issues, we need to think really carefully about that design, that architecture of our survey. We need to think about the order of the questions. We need to think about the type of questions that we ask, and we need to think about the wording in them. So when we're ordering questions, the ordering of questions in a survey is really important, particularly when it's a very in-depth survey. I worked with one team before who were carrying out a very detailed survey with leavers from a care system. And they really had an awful lot of in-depth questions, and the structure of them just didn't flow for me when I was working through it with the team. And so we really had to do a piece of work. What you want to do is help respondents take a journey through your questions. You want to use your first questions as a way of prompting them to think about the later questions, to think about those memories, for example. And so you can really guide people through if you order your questions in a useful, structured way. And what is helpful is often to talk about the quantitative first, use quantitative questions first, move to qualitative, move from the factual to the abstract. Start with your easiest questions, then go into the more depth ones, and that just gets people into the way of answering and begins to open them up a little bit. And if you can at all, use an overall rating, can be really useful in your survey, and finish with a feel-good factor if you can. So, and thinking about the types of questions that we can ask, we're going to think first about ranking questions. So these are very common, obviously, in survey design, and you can use ranking questions to compare multiple items and to force a differentiation between items in a way that a rating scale cannot. And I'm going to show an example in a couple of slides' time around the difference between a rating and a ranking question. But what I would say is just be mindful that some ranking questions can make an assumption. So in this example, you can see it, rank the following symptoms, how much they have affected you, but you don't know whether the person has actually experienced that symptom. And if you haven't given people a way out of answering that question, you're going to get some data that is essentially unreliable. And we also need to be mindful that it's really easy for people to make mistakes when they're ranking items. And it can be hard and more time consuming to actually analyze the responses. So for example, if you've got people to rank the symptoms, then how do you differentiate between the middle ones? Quite often it's easy to understand, well, that was their number 1, that was their number 5, but what's the difference between 2 and 3 here? Because people can often find it very hard to do that. So rating questions can sometimes be an easier tool to use in a survey. For example, please rate how easy it was to book your appointment. So they're very common in surveys and they can be really useful when you need to differentiate between respondents or you want to use your survey repeatedly over time. And we might come back to what that can look like in a QI project later. But I would say that generating any kind of Likert scale for people to rate things on can be very difficult. So wording them can be really challenging. Generating a Likert scale is a bit of a balancing act. The more points you have on the scale, the more sensitive it will be. The less points on the scale, the more reliable it will be. So you're always trying to balance those 2 options. I suppose my top tips for ranking or rating questions, Likert scales, would be have a midpoint on the scale. It kind of forces people into a positive or negative, but also use that neutral point in the middle to make sure it's clear. And it's been shown by some research that that is a better way of trying to find that kind of feedback. And so therefore you're going to want an odd number of points on your scale, and usually 5 or 7 can work, although at times I would use longer scales depending on the topic. So it can be quite tricky, as I said, to understand, well, which one do I want? Do I want to get people to rank these options, or do I want to get people to rate each one individually? So here's an example, an everyday example. So again, maybe thinking about my coffee shop and what I'm going to order, I'm going to want to know, well, what kind of crisps do my customers want me to have in stock? Or if I'm organising a party, what do I want to buy most of? So if I get people to rate each one of these individually, well, I might be a big lover of crisps. In fact, I am. So if I was asked, well, what do you think of these particular brands on the screen? I think they're all great. So I'm just going to rank them all really highly. So if I'm the organiser of the party, I don't really know which one to get because everybody loves them all. Whereas if I get people to rank their choices here and, you know, potato, cheese and onion come out as the top choice with most of my respondents, then I know that's the number 1. I'm going to buy more cheese and onion potato than I'm going to buy of anything else. And I suppose I should say other brands are, of course, available. So if you or your guests just rate each one, it's not going to help with how many you buy, but ranking them in this particular option could be the best choice for you. So you want to check relative advantage, and ranking is really useful for that. You'll also want to use in any survey typically some open questions. They're typically used less frequently in a survey, probably partly because they're more difficult to analyse and they're also more time consuming and more challenging for our respondents to answer, particularly if you are working with harder to reach groups in the kind of survey that you're putting out. So they are used less, but they can be really useful and they can provide some really useful data. So often, I'm sure everybody's experienced it in a survey where you get, do you have any additional comments for us? And that can really work to help people explain why they have answered something in a particular way. So they can provide that really rich and reliable data, but I would just say be careful with the analysis of it. Qualitative data can be a difficult item to analyse, and I would say that in many cases I've seen qualitative data analysed in not the best way when it comes to surveys. So when you see, I've had teams say to me that their qualitative questions didn't quite fit with their quantitative questions, and when I've looked at the survey design, I thought, well, actually the way that the questions are worded is not helping with that. So qualitative data needs to be handled in a particular way, and that's a whole other topic that we could cover in another session. But what I would say today is open questions can be really useful, but keep them brief and maybe keep them limited, because it will put people off answering if they're asked too much. So back to our coffee shop example. And what I've put together is just a very brief survey, and I would want this to be brief because the other issue is you want your survey length and design and how much it covers and how much detail it goes into to be commensurate with the topic that you're dealing with. So a visit to a coffee shop is not going to have a 5-page survey about it, whereas my survey that I helped folk with before around the care levers, that was a long survey, but it warranted that because you really need that rich data, and it's a topic that obviously requires a lot more detail and consideration in how people answer. So a quick survey for a coffee shop visit, we might just start with, well, what did you call in for today? Was it brunch, morning coffee or lunch, whatever? Give people a choice in that. That will make it much more easy for me to analyse than people saying, if I put an open question there, I would have to analyse that data more thoroughly. Giving people a choice makes it much more simple for them to answer and for me to analyse. And then I can filter my data in the future with, I'm just going to look at what the people calling in for coffee thought about, or I'm just going to look at my lunch customers. I would then maybe start with, excuse me, my questions about the speed of service. So remember I said that I want to be really specific. I'm not just saying what was the service like, I'm particularly asking about the speed of the service. And I could then integrate that data with the answers to the first question and work out whether or not people felt that they received a better service at lunchtime compared to coffee time. And then I might go into my question about how friendly were the staff during their visit. And this would allow me then to rate this. And what I've done in those Likert scales is they are designed for each question. It's not a generic Likert scale for each question. So the next slide just shows you how I would finish off the survey really, which is showing about, well, what did you have today? And I would filter this. I would use branching in this. I don't want to ask people about food that they have if they didn't have food, obviously. So I would filter that data and branch the survey to show that. And I would then go into using a matrix around the food that they did have. So only the people who received food are going to answer the next questions. And I'm just going to use a scale for 3 dimensions of the food. So range of choices, quality and value for money, and a simple Likert scale for people to answer on that. And then I'm going to finish off with an overall rating because that's what I'm really interested in, people overall showing how satisfied they were with their visit. And I'm just going to use my Likert scale. And what I'm just going to say about that is I would use a 7-point or potentially a 9-point there, because this could really link very nicely to my overall outcome measure. And what I would want to do is make that scale sensitive enough to show change over time. If I only had a 3 or a 5-point scale here, I wouldn't be able to track that over time. And that can be really important in designing surveys for quality improvement projects. So the next slide just summarises the common pitfalls that I'm sure you have all mentioned earlier on in the chat function. And in summary, I suppose, when we take a really considered approach to designing surveys, we can actually manage to address those issues. And I'm going to leave that slide, and it's in the slides that you will receive afterwards, as well as a number of top tips that you can refer back to, and hopefully they'll be useful if you're designing your own surveys. So thank you all so much for listening today, and I see some questions coming through in the chat there, so I hope it's prompted some thinking this afternoon.
Well done, Anita. That was a tour de force there through survey methodology and the value of surveys, so thank you so much. And you certainly have ignited our audience. Just to say, we have a fantastic breadth of audience, and I can see lots of people joining us from Northern Ireland. You're all very welcome, and also lots of people from speech and language and from other health and social care professional groups. So great to see everybody there joining us. And yeah, we've loads and loads of comments and questions coming in there, and Anita, I just want to go back a little bit. You set out, you didn't set out to do your PhD in improvement necessarily, but you came across the value of surveys. And would you just tell me a little bit about how you saw, you came to recognize how important this was?
Yeah, so yes, I think I mentioned in the bio that I sent through relating to today's session that I never expected myself to be a methodologist by any stretch of the imagination. I'm very much a clinician at heart and still like to think of myself that way, although I haven't practiced for quite a few years. I stepped out in 2016 from a clinical team to do my PhD, and that was around designing an intervention to support children in the classroom with working memory, attention and language difficulties. But what we became really interested in was how that intervention would work within a very complex system of healthcare professionals delivering interventions within an education setting. And so that got me into thinking a lot about methodology, about complex interventions within complex systems, implementation science, improvement science. I had already done my master's a few years before that had covered improvement science. And then I had the opportunity to go back to the Belfast Trust to work with my AHP colleagues around QI projects who were delivering frontline services and really wanted to work with their patients and co-produce a lot of work with their patients to improve what they were delivering. And so that led into a real interest in this methodology as well, because so many of my teams were using surveys and coming to me and saying, well, we did this survey, but I don't have the data that I need, or I've got a survey to do and I've no idea where to start. Or they would send me through a draft of a survey and I would just look and think, this is a really great start, but what are you going to do with a lot of this data? And I think one of the things is about thinking about that analysis from the beginning, because if you're not going to use the data or it's not going to tell you what you want, and often I would say to people is, how would you respond to that question if you were asked it? Because sometimes people ask a question in a way that's really challenging for anybody to answer, particularly our patients who don't have our mindset on when they're reading what you've put in a survey. So sometimes I would say to my teams, it's a really good question in some ways, but how would you answer that? And if you're going to find a hard answer, then definitely your patients are. So yeah, it's been a bit of a journey.
I think, I suppose it's one of the most used tools in research, but also one of the most abused tools. And I think you've certainly given us some great guidance on that. And you quoted Deming earlier, in terms of quotes. And my favorite Deming quote is, don't just do your best. You have to figure out what to do and then do your best. So I think, learning about surveys, learning about methodology is really important before we go and try and make care or design better services that are better. We've lots of questions coming in there. I think a lot of them relate to kind of practical application of this, and people are looking for some guidance on some good examples of surveys, and also some questions around validation of surveys. So I think you have a couple of slides just on that, I think, in addition, that kind of address that.
Yeah, so I've put in slides at the end of today's presentation that give just a few top tips, and it's really about those common pitfalls that we mentioned. So things like using the earlier questions to prompt reflections, that can be really useful, particularly with patients. One of my teams had looked at care after leaving hospital, but people need to think about the experience of leaving hospital. That's a very emotional time for people. It's very hard for people to think back to at times as well, and particularly people are still feeling unwell, etc. So it's really important to use your earlier questions before you start digging into the deeper points, both to prompt reflection and to actually warm people up and help them open up and give truthful, honest responses as time goes on. So there's a few, different tips in there. Branching is really important, and tools like Microsoft Teams are really useful and easy to use, and it's very easy to set up branching. It's very frustrating if you're filling in a survey to have to answer questions that aren't relevant to you. So I would definitely say using branching to make sure that you reduce that is key. And avoid reliance on memory if you can at all, because a lot of the time we are asking patients to remember things, particularly if it is for improvement work, to remember things that were either very challenging or emotive or just too long ago. So the timing of your surveys as well is really important. And again, we covered this as we were chatting through, so be precise and apply your operational definitions, know those constructs that you want to measure. Don't ask two questions in one. This happens a lot, and it leads to a lot of bias in results.
Do you have any good resources where there are banks of well-designed or good, surveys that we can kind of say, these are examples of really good?
There's a useful handbook developed by Qualtrics, which is one of the platforms that you can deliver surveys on, and the Qualtrics handbook is very useful. Now, what I would say is when you read into survey methodology, there can be quite a variance in people's opinions. When it comes to the Likert scales that we mentioned, some people say don't put a neutral point in, other people say they really think you should. So it can be quite hard to know exactly which way to do it. But again, another top tip I would say is test the survey before you do it, and if possible, before you actually launch it. And if possible, try to test it with people similar to the cohort of respondents that you want to reach. So I think that's really important, just to test it out. Test it with colleagues if need be, but if you can test it with a few other people, that's really useful. And then you'll get people saying, oh, I didn't really know, so I just put neither agree nor disagree to everything. So, and that'll tell you about your wording. So the testing of it is very important.
Yeah, one of the things we do when we teach quality improvement is we get people to apply, let's say, methods like PDSA to the development of a questionnaire, you know, and you know, designing it, maybe checking out with one person before you give it to 100 people can be a very valuable thing, and so you can learn from one respondent as much as you can from 100. Lots of questions there on Likert scales, and one I'm interested in there from Kevin is just about, you know, having kind of maybe Likert scales that force us to pick a side, you know, and smaller numbers. What are your thoughts on that?
Yeah, so Likert scales are really useful, but also very tricky. So I did touch on that. I think my big point is always label the points on a Likert scale if you can. Now that gets trickier, the length of the Likert scales. If you're going to have 7 or 9 points, that's very hard to label each point on it. And I would sometimes then revert to a 1 to 9 or 1 to 7 scale. But if you've got 5 points, you do often see, I think I had on the slide 5 stars, and people say, well, which, you know, give it your ranking. That or your rating, that is useful sometimes, but you don't know whether one person's 4 stars is the same as another person's 4 stars. So it really affects the reliability of what you're measuring. And I think I would try and label them if at all possible. There are some topics that it's very hard to label. So I have put a slide in that has an example of a few that might be useful to people. It's very hard when it comes to time. Time is a tricky one to put on a Likert scale. Frequently versus often versus, you know, never is okay and always, but in between it gets really hard to word them. So I'd be really cautious about that. But I think, you know, something like strongly agree, neither agree or disagree, that tends to be quite useful. Importance, quality, satisfaction, those ones are quite easy to use. And I sometimes just try to stick to a small set of Likert scales. I did put an example in about the coffee shop about friendliness, but then you get neither friendly versus unfriendly. It's a little bit awkward to answer. So yeah, as I say, there's different schools of thought and whether you should have the neutral point in. I tend to find it helpful to have an odd number and have that neutral point.
Great. I really want to visit this coffee shop. I think we put a lot of effort into making it so much better. I think.
It's the retirement dream, John.
Can I ask about co-production? You know, which I suppose is at the heart of so much quality improvement now, and how do we work with patients and patient groups and interest groups and even the public in designing, you know, surveys, and I suppose even you know, maybe going back a step before that in terms of deciding what the goals of surveys might be.
Yes, absolutely. I mean, one of the things that we do a lot of here within HSCQI is work with our lived experience partners on co-produce and everything that we do. And the most effective way that we have found around that, I mean, it's different, I suppose, for people working in clinical practice, but we have found our community and voluntary sector organisations to be fantastic partners in this work. So, for example, I lead an improvement programme here for HSCQI called Delivering Value, and we have a work stream around older people, and we have a really strong connection with AgeNI around this, and they have a consultative forum, and that's been a fantastic because you're getting people from that demographic that you're interested in, but also with really good level of insights. And I think so that's been very, very powerful for us. Absolutely use your patients that you're working with if you're in a clinical setting, but it is important that you consider carefully who you're asking to be involved in that co-production work, and that's been my experience in the past. So, but I would involve them at every stage, really, right from the inception of a project right through to the evaluation of a project. So I think it's important, and the wording of questions, they can really give you insights into, oh, don't use that word, people won't know what you mean.
A question from Fiona Dixon there, just recommendations on survey software that meet governance needs of health and social care in terms of data safety.
So yeah, and I think that can come down to individual organisations. So I would always check that out with information governance teams. So when I worked in the Belfast Trust, for example, all of our teams were at times completing DPIA, so data protection impact assessments. I assume there's similar across services everywhere. And I think you need to check that out with your own IT or information governance teams as to what will be allowed and how you're going to store the data. Most of the time, if it's anonymous data that you're gathering, which a lot of the time it is in quality improvement projects. You shouldn't run into too many issues. And we do use Microsoft Forms a lot to gather data, and that's really easy to use. Obviously, there's your other ones that are paid for, like SurveyMonkey, and there's multiple platforms out there that you can use. But I think it's just important to check within your own organisation about the governance around those tools.
Have you played with AI at all in terms of validating surveys or giving you feedback?
I mean, not in terms of validating surveys, but you will see if you use Microsoft Forms nowadays, AI is right there behind it, and it will start suggesting questions to you.
Really?
I would just say, just be careful that the AI isn't dictating what you need, that you're coming back to those constructs. What is it I need to measure, and making sure that you're getting your aims out of it and not just going with what the AI suggests. But it can be useful. I mean, they do suggest the Likert scale options and things like that when you go into Microsoft Forms nowadays, which when I started using it, it didn't do. So I guess AI is there to stay, and we can use it to our advantage at times, but it's never going to replace our own thoughts on things. So.
Anita, there's loads of questions still coming in, and just some requests for slides, if that's possible, please, afterwards. Just, and I think really for your top tips, I think, and obviously this session is recorded as well, and people can watch it back again for to go over specific areas.
Yeah, and the slides will be available, absolutely. And the top tips, I'm sure everybody has other top tips, and you know, sharing those top tips with each other is really useful. I think a lot of the top tips are really common sense, but it is just worth reflecting on them as you design a survey, because, you know, and I did say earlier on that my absolute top tip is stop and think, don't just jump in. That's been the one thing that I have seen so many teams doing. Oh, we need to do a survey, and start with writing the questions, and then you have to unpick those questions. And once you've started yourself, it is around our cognitive processes ourselves. Once you've put a few things on a sheet, you start to really like those questions, and you start not to want to ditch any of them. And your survey just gets longer and longer, because then you realize the other questions that you definitely need. And so you have to, you know, sometimes we say in quality improvement, not all our babies are lovely. So you might have written a beautifully worded question and you think it's fantastic and you really want to keep it in your survey, but sometimes you just have to go, it's not for this one. So that is the one issue that I've seen so much, people jumping in, writing questions, and then the survey gets so long, unwieldy, and people just will not fill it in, and you just won't get the data.
Look, I think this has certainly sparked great interest. I think there's lots of nice comments and questions in the chat, and people sharing resources as well. So before you sign out, do have a look at the chat. I'll give you one last question, Anita, from Billy Gregg. How to overcome respondents being unintentionally identified in small surveys of healthcare workers and ending up with bland responses, or equally kind of people, you know, being possible to identify people, you know, so how do we protect against that? And
yeah, I mean, it's the same in a number of, it can be the same with focus groups, it can be the same in any kind of research methodology, where you end up where you realise your respondents are really very identifiable by, and you know, we experience it a lot in Northern Ireland, where we might want to ask, what trust are you from, if we're doing work with staff, or, you know, what's your profession, what's your trust, and sometimes that's enough. And I usually would definitely steer away from asking anybody a job title, because that can very much give them away sometimes. So it's balancing it. Sometimes in surveys, I think you need to not ask some of those questions that you really want to ask about the demographics, because it will put people off responding. So if it's information you really need, then absolutely put it in and just word it in a way, or using groupings in your choice questions can work sometimes. So, you know, instead of, you know, what's your profession, are you an HP, medic, nurse might work, instead of saying, are you speech and language, OT, physio, whatever. So, you know, keep it as broad in those big categories if you can, to try and reduce how identifiable somebody is. But sometimes you just have to decide, this is going to put people off, and just leave it out.
Well, fantastic, really great. And so many lovely comments there, and like I think you've really met a need in terms of this, and I think it's safe to say, I think practice. I think you know, and reflect on what you do, but you get better from doing, I think.
Yeah, absolutely. The more you think about these things, the more surveys you design, the better and quicker you will get at it. And you know, as I said, testing it out with colleagues, patient groups, whatever, is really useful as well. So you absolutely get better at it with practice. So like all things QI.
Yeah, indeed. Thank you, Anita. Thank you so much. I'm going to
Thanks,
just
everybody.
move on, Chris, to the last couple of slides. And so great, big thanks to Anita. Fantastic session. Please do consider joining us for our next QPS Talk Time. Clinical Audit and Humans and AI Smarter Together is the title of that one. So I think you know, you'll find that very interesting, and scan there will bring you to register, and we'll put out some more material on that closer to the next session. You can watch back on all our previous episodes on our YouTube channel. Also, you can see past episodes on Spotify. And let us know how we did today. I think we value your feedback, and you'll get an email afterwards, or you can just give it to us directly. And then finally, for me, I've just put a quick a plug in the chat there for the HEPS, the Healthcare Ergonomics and Patient Safety Human Factors related meeting that is happening in Dublin in June 18th to 20th, and you can come for the 3 days, or you can come for a day. So if you go to the link there, have a look at the program and see if there's a particular day that interests you. And there's lots of things on AI, on again using quality improvement methodology to improve care, and how that interacts with human factors. So thank you for a great session, Anita, and we look forward to seeing you all in a couple of weeks' time for our next QPS Talk Time. Thank you.
Thanks, everyone.